so honoured and excited to have Dr. Dyson here with us today. I have personally followed her work for a long time, and it's helped me with my own students of being able to explain, you know, why things might not be working between them and their horse. But Dr. Dyson's understanding of musculoskeletal pain in horses has literally changed the world for horses. She graduated from the wonderful University of Cambridge in 1980 with an honours degree in applied biology and a degree in veterinary medicine. She then attended the University of Pennsylvania on a highly regarded Thoron scholarship, where she completed an internship with the large animal medicine and surgery at the New Bolton Centre, which is a very famous centre in the States. I know a lot of you, I can feel you nodding out there. Upon graduation, she went into private practice before we stole her back to Great Britain, where she took the incredible position of orthopedics at the Animal Health Trust. Her documentary has changed the world, recognizing the 24 behaviors indicating pain in the ridden horse. It is a huge game changer. We are beyond honored to have you here with us, sharing your knowledge in what is changing the world for horses in a very, very positive way. So thank you so much, Dr. Dyson Sue, for being here with us today.
You're welcome. It's a real pleasure to be here.
Oh, it's wonderful. So I'm just going to dive straight in there. You qualified as a vet. You're in America. Why did you focus particularly on pain? Because I think you focused on the pain element in horses from quite early on in your career. Is that right?
It is because I came to be an equine veterinarian because I was a rider, and I was fortunate enough to produce some horses to a relatively high level in both eventing and show jumping that then went on to compete internationally at Olympics and World Equestrian Games. So I felt that I was very much aware that lameness was the most common cause of days off from work. And I was also aware through various horses that I owned, and I took on some difficult horses. I took on some horses that finished up having some musculoskeletal problems, and I was conscious by daily observation about how this could influence their performance. So it was a natural step that once I was qualified as a veterinarian, that I was going to go down the route of lameness and poor performance. And that was really what drove me. And the more I looked, the more I asked questions. I found out some stuff, but I wanted to ask more and more questions. And then ultimately, I got to a stage of real frustration that owners were not recognizing discomfort in their horses early on. And the longer a problem has been present, the more secondary problems the horse develops as it changes its pathway, neuromuscular pathways, it changes its way of moving, so it loses muscle, and the problems become more complex. So I was fed up with having owners come to me and say, well, actually, this horse has never been able to canter properly on the left rein. And they've never is throughout the time of ownership. And it's now 8 and they bought it since 5. And clearly it had had a problem that people hadn't recognized. And then I was very aware that veterinarians were also rather poor at recognizing low-grade lameness that was resulting in poor performance in ridden horses. And if they could not see overt lameness in hand or on the lunge, they would kind of say, well, the problem must be behavioral then, rather than a pain-related problem. So vets were getting it seriously wrong. And then I was involved with a very high-profile event horse, which was insured for loss of use, and it had some major musculoskeletal problems from my perspective. And I felt it had a very poor prognosis. We treated it, and it hadn't responded to treatment. And the veterinarian advising the insurance company refused to accept the claim and kept saying, we must retreat this horse, we must retreat this horse. And the horse was deteriorating. And I was sending videos to the insurance company and finishing up writing the strongest letter I'd ever written to an insurance company, saying that this horse is in pain, we must do something about this, this is not fair on the horse. So this really made me say, I've got to do something about this. I've got to educate people about
Yeah.
the behavioral manifestations of discomfort. So when I went into the work, which was not done alone, it was done in association with a group of us. I had been fortunate enough to meet an American who was a veterinarian who'd specialized in animal behavior and in welfare, so was double board certified. And I showed her some videos, and she said, yes, of course, these horses are in pain. So it was good to have the backing of a qualified behaviorist, because then the work that we then did had credibility within the behavior world and slowly gained credibility within the veterinary world. And this was like pushing water uphill, really,
Oh,
in
yeah.
that there was a lot of resistance, but particularly from the older members of the veterinary profession. They were extraordinarily skeptical, and it has taken years to gain acceptance, but it has been gathering momentum rapidly,
Yes,
which is great. But it's
hugely.
been a bit of a struggle.
And anything that's creating change is slow and it's challenging, but you just chip away and then the right people see it and they share it. And, I think as well is depending on the amount of students that I've had, I focus on the relationship between the horse and the human. Who do we need to be that the horse wants to work with us, wants to harmonize with us? And people will say, I don't know what's wrong. I send a video. Well, clearly the horse is in pain, but I've had the vet, I've had the physio. Farrier will say it's the feet, dentist will say it's the tooth, the physio will say it's the body. People receive an awful lot of differing information, or they're told, no, I can't find anything, crack on. So tell us about the ethogram that you produce so that people, general lay people with horses, can identify themselves what these signs of pain are.
Well,
What
I think it's best if I do this by starting a presentation,
Let's
because
go
then I
straight
can
into it.
show
Absolutely.
show you the pictures and just give you a
Fabulous.
little bit more background to it as well.
Yes.
Oh, sharing is not turned on. Sending requests.
Okay, Callie will be there. We are. We can allow that. You should be good now.
Oh, this is looking promising. Accept it's at the beginning.
Get your notepads, people.
So, we're going to be talking about how really the recognition of pain can influence performance so that we achieve the goal of harmonious horsemanship, which to me has to be the ultimate goal. And why won't this advance? Let's try here. Okay. So I've come from this as somebody who has always ridden. I've also qualified as a British Horse Society instructor. I've been a clinician and a clinical research person, so always asking questions, always asking why. And I think that that's a really important thing, to be curious all the time. And I've been very fortunate to have had some horses that became superstars. So I have had the experience of knowing what a normal horse should look like and feel like, and differentiate between normality and abnormality. And one of the problems I think that we face is that some riders have never had the opportunity to ride a truly normal horse, a truly pain-free, comfortable horse, and therefore do not necessarily know what that should look like or feel like. And ultimately, I feel that our goal is harmonious horsemanship. So the horse and rider are, as a team, in synchrony. So like you're dancing with a partner and you intuitively react to each other. So it's two-way communication. So there is instant responsiveness to light cues. The horse moves willingly, and there's an absence of discomfort and an absence of stress. And I think there's been a misconception that horses don't want to do things. whilst not recognizing that horses don't have the mental capacity to decide often what they're going to do or not do, but they may not want to do something because they're uncomfortable. So that we had this unfortunate episode when a trainer was videoed hitting this horse with a branch to encourage it to jump down into water. Earlier on in the video footage, we had seen this horse trot down into the water without any hesitation, which to me indicated that the horse was not frightened of the water, but it did not want to jump down into the water. So the question that I then ask is, why did it not want to jump down into the water? When this horse was seen trotting around on the grass, I could see that it showed a forelimb lameness. So my interpretation of this situation is that the horse doesn't want to jump down into the water because it anticipates that it's going to be uncomfortable landing in the water. And therefore, I think as a coach, you always have to think why and not ignore the why.
Mm-hmm.
I think that there has been a lack of awareness of the prevalence of lameness. And there have been a number of studies done in Switzerland, Sweden, Denmark, and the UK, which indicate that approximately 50% of horses that are in regular work and are considered by their riders to be working comfortably are in fact lame. And I think this is a global problem. So there's been a lack of recognition of pain-related gait abnormalities. And within the horse industry, I think we have a rather antiquated attitude. And there's a blame culture incriminating either the horse being unwilling or
Yeah.
lazy or naughty, or the rider is blamed for not being strong enough or applying their cues incorrectly, or the horse is said to be weak. And of course, we're going to have some horses who are more challenging to train than others, and rider position can have a huge influence on the way in which a horse moves and performs. And if the rider applies confusing cues, the horse is not going to respond adequately. But I think we always need to be asking the question, does the horse have discomfort? So I think partly because we learnt to ride at riding schools, at which many of the horses have got low-grade discomfort and therefore display a variety of behaviors which we now know are abnormal behaviors, such as tail swishing, putting the head up, putting the ears back. These behaviors have become normalized. They've been accepted as being normal for horses. Whereas I think we now have very good evidence that these behaviors are not normal for horses which are comfortable. So I think it's really important to appreciate that just because a horse appears non-lame when evaluated in hand or on the lunge, it doesn't preclude the possibility of musculoskeletal pain when the horse is ridden. And that's a really important concept to understand for riders and trainers and the veterinary profession, everybody involved with horses. And I think we also need to think about the term conflict behavior. And if we look at the definitions provided by the International Society for Equitation Science, with respect to ridden horses, these are behaviors which are caused by the application of opposing cues simultaneously. So, for example, applying a leg cue, but restricting with the hand. So asking the horse to go forwards, but at the same time saying, don't go forwards. Very confusing for the horse. So it can show abnormal behavior. And some of those abnormal behaviors are going to be similar to those behaviors that we see in association with pain. However, I do not think that conflict behavior results in 8 or more of the 24 behaviors that I'm going to describe to you, which comprise the ridden horse pain ethogram. So can we differentiate between conflict behavior and primary pain? And I think that the answer is yes. So what is the ridden horse pain ethogram, which we sometimes call the ridden horse performance checklist, because that is sometimes more acceptable to riders than the use of the word pain.
Mm.
So an ethogram is a series of behaviors, each of which have a strict definition. So, for example, with respect to the ridden horse pain ethogram, the front of the head being behind a vertical position more than 10 degrees for 10 seconds or more. We developed the ridden horse pain ethogram by comparing the behaviors of comfortable horses versus horses that we knew had musculoskeletal pain. And we started off with a list of 117 behaviors. And by the application of these 117 behaviors to a group of lame horses and a group of non-lame horses, we were able to identify those behaviors which occurred most commonly in the lame horses. And we finished up with these 24 behaviors, the majority of which are at least 10 times more likely to be seen in a lame horse than in a non-lame horse. And we have demonstrated very strongly that a score of 8 or more of the 24 behaviors indicates the presence of musculoskeletal pain. But it's important to recognize that it is the total score which is important. I'm going to describe to you each of the 24 behaviors. And for many of the behaviors, there could be several different causes. So it is the total score that's important, not the display of individual behaviors. It's also important to recognize that some lame horses, some horses which may only have a mild lameness, which is recent in onset, may score less than 8 out of 24. So,
Sue, can I just say one thing
yes,
for us to make it clear to everyone? When you're talking about lameness, a lot of people think, oh, but if my horse is lame, it's hobbling along you're talking about lameness that can be very subtle and people may not even realize their horse is lame.
absolutely, because many horses show lameness on more than one limb. So both hind limbs or both forelimbs may be affected. So they move symmetrically
Yeah.
most of the time. Although if we put them under different circumstances, such as a 10-meter diameter circle, when ridden, we may be able to see more obvious lameness. We
Thank
always have to think that any poor performance during ridden exercise may be due to lameness, but not lameness in the conventional sense, not necessarily limping. And it may be that the horse may look okay in trot, but actually show abnormalities of canter. So the so-called four-beat canter, so lack of a suspension phase in the canter, is generally the result of pain. Becoming disunited is often the result of pain.
thank you.
So let's go on and discuss the 24 behaviors, which are divided into 3 categories. They are facial markers, body markers, and gait markers. So the first is the ears being behind a vertical position for 5 seconds or more. The eyelids being closed or semi-closed for 2 to 5 seconds. The sclera, or the white of the horse's eye, being exposed on a repeated basis. And be aware that often horses show several signs simultaneously. So this horse on the left has got a very marked head tilt as well as exposure of the white of the eye. The horse exhibiting an intense stare, which we could also describe as a glazed expression or looking zoned out for 5 seconds or more. We can see that this horse also has its tongue out. The mouth is open with separation of the teeth. and the bit is pulled through to one side of the horse's mouth. The mouth being open with separation of the teeth for 10 seconds or more. The tongue either hanging out continuously or moving in and out. The bit being pulled through to one side of the horse's mouth on a repeated basis. Then there are the body markers. The horse tilting its head repeatedly so that one ear is lower than the other. Repeated movement of the head up and down, not necessarily continuously, but during a work period, seeing alteration in the head and neck position in the midline. The head being in front of a vertical position, at least 30 degrees for 10 seconds or more. The head being behind a vertical position, at least 10 degrees for 10 seconds or more. The horse changing its head position from side to side on a repeated basis. And again, not necessarily continuously, but you see a change in the horse's head position from side to side throughout the period of work. The tail either being clamped to the midline or being held crookedly, in this instance, to the left. Repeated swishing of the tail. A rushed gait, which is defined as a frequency of trot steps of more than 40 per 15 seconds, or an irregular rhythm with repeated changes of speed in either trot or canter. The gait being too slow, which is defined as a frequency of trot steps of less than 35 per 15 seconds, which often looks, particularly in a dressage horse, as a passage-like trot, as we see on the left. The hind limbs not following the tracks of the forelimbs, but being deviated to either the left, as we see here in canter, or in either trot or canter, or both. Problems with canter. Either repeatedly striking off with the incorrect leg leading. So this horse is on the left rein, but it's striking off with the right forelimb leading. Or the horse changing legs, either behind or in front, becoming disunited or cross-cantering. So the horse is in right canter, initiated by the left hind limb, and then it is changing to the right hind limb being the new trailing limb. So changing legs behind. Spontaneous changes of gait. So for example, the horse breaking from canter to trot or from trot to canter without the rider asking the horse to change gait. The horse either stumbling or tripping repeatedly behind, as we see here, or in front, or the horse having a bilateral hind limb toe drag. Sudden changes of direction against the rider's cues. So this rider's intention was to come down the fence line straight, but the horse has chosen to deviate to the left. Or the horse spooking, seeing an imaginary ghost in the corner of the arena. The horse being reluctant to move forwards freely, requiring either verbal encouragement or repeated strong leg cues, or the horse stopping spontaneously. The horse either bucking or the horse rearing. So to reiterate, a score of 8 or more of these 24 behaviours indicates the presence of musculoskeletal pain, even if you can't see lameness. Some lame horses score less than 8 out of 24, but remember, it is the total score which is important. Now, in order to further verify that these behaviours are induced by pain, we have compared horses before and after the use of nerve blocks. So nerve blocks involve injecting local anaesthetic solution over nerves to effectively numb part of the limb. And if the pain is coming from that part of the limb, then we expect to see improvement in the lameness. So this helps us to verify or to identify where are the sources of pain. And we have done 2 studies in which we've shown that if we take away the pain by the use of nerve blocks, we get reductions in the ridden horse pain ethogram scores. So if we look at this graph, on the vertical axis, we've got the total score out of 24, and the red box shows the horses before the use of nerve blocks. This is the right results from 150 horses. The red box represents the scores for the middle 50% of the horses, and the other 25% of horses are represented by this bar here and this bar here. So we can see the vast majority of horses are scoring above the threshold of 8, indicated by the dashed blue line. And the median, or the most common score in this instance, was 9 out of 24. The maximum score was 15 out of 24, but we could see that some of the lame horses scored less than 8 out of 24. And we had one outlier which scored only 2 out of 24. This horse had a low grade right forelimb lameness. And on the right, in the magenta, we can see the scores after the use of nerve blocks to remove the pain. And we can see we've got substantial reductions in the scores. So the most frequent score now is only 2 out of 24. And the vast majority are between 0 and 6. We do have a small number of outliers which have persistently high scores. This tells me that these horses must have a source of pain that I have failed to eliminate. And in fact, all of these horses had a component of neck-related pain. And in this graph, we can see each of the 24 behaviors on the horizontal axis. And on the vertical axis, we can see the frequency of occurrence of each of the behaviors. The white bars represent the frequency of occurrence of each of the behaviors before the use of nerve blocks. So an intense stare was seen in approximately 85% of the horses. The blue boxes represent the frequency of occurrence after the use of nerve blocks. So after the use of nerve blocks, the presence of an intense stare has reduced to about 22% of the horses. Some of the behaviors, such as bucking and rearing and the gait being too slow, were completely abolished when we took away the pain. But in some of the horses, we see that the reduction in behavior is relatively small. So head behind vertical was only reduced to 32%. One of the explanations for this is that some of the horses which they had their head in front of the vertical position before the use of nerve blocks, after the use of nerve blocks, lowered their head spontaneously so that the head finished up behind the vertical position. So the immediate reduction in the pain scores or the ethogram scores tells us that these behaviors are not habitual. there is an immediate reduction in the frequency of occurrence of these behaviors. And this tells us that there must be a causal relationship between the behaviors and pain. But bear in mind, once again, it is the total score that counts, and each individual behavior may have a variety of different causes. So, how do we use this checklist? We can use it anywhere, at any time. We need to be evaluating the horse for between 5 and 10 minutes after a period of warm-up, and the horse needs to perform its usual range of movements that it is capable of. But we need to be aware of a certain number of things before we get started, and we'll go into those in a little while. I would always advise using a checklist. Don't try and remember the behaviors. Watch carefully. Watch the horse for at least 5 to 10 minutes and make notes. So for example, I might say the horse has its head behind the vertical, especially in 10-meter diameter circles. And when you're starting, you need to use a stopwatch so you can time each of the behaviors. And because it's a learning process, I would always suggest that you start by looking at video recordings, good quality video recordings. So although the assessment can be done anywhere, I ideally like to do it in an arena. And when the horse is working on the left rein, I would stand in this blue corner so that I can watch the horse move away from me, from the side, and then back towards me. And then I move when the horse is on the right rein to the yellow corner. So again, I can see the horse from behind, from the side, and coming back towards me. And we have actually designed a purpose-designed test of approximately 8.5 minutes duration, which I think is a simple test, but in walk, trot, and canter, and transitions, and circles of 20 meters and 10 meters diameter. And we can distribute that test if you want.
Yeah.
I just wanted to make a point that 10-meter diameter circles, true circles, ridden as on the left rein and then the right rein back to back, can be hugely valuable in both accentuating the presence of lameness and also accentuating some of the behaviors. So that we can see that this horse has got its eye closed, its ears are back here, the head is behind a vertical position, it's got a hind limb toe drag. And I think it's also important to recognize that in some horses, they may look pretty good in trot. So this horse looked very comfortable in trot, but looks very uncomfortable in canter. So in trot, its ears are forward, the front of the head is in the vertical position, it's not swishing its tail, it's looking like a happy horse. Whereas in canter, its head goes behind the vertical position, it starts to do little bucks, it puts its ears back, it swishes its tail, it shows an intense stare, it goes crookedly, it opens its mouth. So we must see horses in both trot and canter. And this is just to demonstrate the difference after the use of nerve blocks. We have taken away the pain and the horse has transformed from this sort of behavior to looking like a much, much happier and more comfortable horse. So before we get started, there are certain things that we need to be aware of because there are some horses in which we can see the white of the eye at rest. So in this grey horse, in the right eye, we can see the sclera at rest, but we cannot see the sclera in the left eye. So we can apply the behavior, exposure of the sclera in the left eye, but not in the right eye. We need to be aware of the width of the bit because if the bit is too wide for the horse's mouth, then we might inadvertently say the bit is being pulled through to one side, when in fact it's just because the bit is too big. And we also need to look at the quality of the arena surface because in a very deep footing, all horses may toe drag. Whereas in this nice gel track surface, to see the arena surface being kicked up would not be normal. Now, obviously, the presence of damage to the tissues within the mouth could make the horse uncomfortable. So we need to know that we don't have any lesions like this in the corner of the horse's mouth, or ulcers on the side of the horse's mouth created by sharp teeth edges, before we get started. And we also need to look at the bit as well, because the bit in itself may be causing discomfort. As I said, some of the behaviors are time related. So we need to use a stopwatch initially so that you can appreciate the duration of time that the horse is exhibiting the behavior, like mouth opening with separation of the teeth for 10 seconds or more, ears back behind a vertical position for 5 seconds or more. I think there are some other important factors that we need to consider that are not incorporated into the ethogram, but may be signs of discomfort. And these include repeated grinding of the teeth, an abnormally high respiratory rate or an abnormal respiratory noise, or delay of recovery of the resting respiratory rate after exercise, relative to the environmental conditions, that is the heat and humidity, and the fitness of the horse, and the intensity of the work that the horse has done. Likewise, sweating disproportionately relative to the amount of work that the horse has done and its fitness, and relative to the environmental conditions, is a sign that the horse may be uncomfortable. The frequency of defecation and the consistency of feces can be a clue that a horse is abnormally stressed, and the horse being abnormally stressed is most commonly the result of discomfort. And then there are things like rein tension, excessive rein tension, the horse leaning on the bit, or lack of rein tension because the horse is putting its head behind a vertical position to avoid any rein tension, or asymmetry in rein tension, the horse leaning on one hand all the time. The general responsiveness of the horse to the rider's cues and its posture after exercise. If the horse consistently or continuously shifts its weight from one hind limb to the other, or stands with the hind limbs camped out behind the trunk, those are abnormalities. So I think using this checklist or ethogram, we can differentiate between training problems and discomfort. A training problem may create some abnormal behaviors, but with correct training, the problems should be rapidly overcome within 7 to 10 days. Horses are quick learners, and most horses are remarkably compliant, assuming that the training is appropriate. I do not believe that a training problem can create a checklist score of 8 or more out of 24 unless there is underlying discomfort. I think something that needs to be addressed is, can pain relieving medication differentiate between pain-induced behavior and a training problem? And the answer is sometimes yes, but sometimes no. So I would advise keeping a diary before, during, and after treatment so that you can record the behavior of the horse and the quality of its work before, during the treatment, and after treatment. And obviously the horse must be in work. The horse must be given a dose which is adequate for its body weight. And this is higher than the dose recommended on the packaging. So we need to be dosing at a rate of 4.4 milligrams per kilogram twice daily for at least 7 to 10 days. So for a 500 kilogram horse, that would equate to 2 sachets twice daily. And then we have to ask, was there any improvement during treatment? Or did you observe deterioration after treatment has stopped? If the answer is yes to either of those questions, that tells you that there must be underlying pain. However, some horses with some pain do not respond to phenylbutazone. So a positive response indicates that we do have pain. A negative response does not mean we don't have pain.
Mm.
We also have to think about the fact that there are a number of different problems that may be contributing to the failure of a horse to progress in its training. And these include ill-fitting tack, the presence of damage inside the mouth, a rider-horse mismatch, and that may be due to a confidence issue with the rider, a skill issue, or the size of the rider, that's either height or weight or shape, and their weight distribution. Don't blame weakness in a horse which is more than 6 years of age or older. They shouldn't be weak unless they have a neurological problem. Do always think about the presence of musculoskeletal pain. So this is just another illustration of how nerve blocks can transform a horse. So this is a horse that just does not want to go forwards at all. We have to appreciate that when a horse is uncomfortable, it may be reluctant to go forwards. It may be unresponsive to the rider's cues. It can alter the rider's position. It can alter the rider's comfort. It can alter the rider's safety because the horse may behave unpredictably by bolting or bucking or rearing. But after the resolution of pain, look at this horse's performance. It's been absolutely transformed. And these changes are immediate. So this horse has got tension. The rider cannot take any rein tension because the horse constantly holds its head and neck in this posture with the head behind the vertical. Tension is normally pain-induced. And the presence of pain can alter the way in which the horse moves and therefore alter the rider's position. So this horse is on the forehand in canter, which is inducing the rider's upper body to rock backwards and forwards. This is induced by the horse's movement, and it is not a fault of the rider. It is what the horse is making the rider's body do. Similarly, this horse has a hind limb lameness, and the hind limb lameness is inducing the saddle to slip to one side, taking the rider with it, and therefore her right shoulder finishes up being lower than her left shoulder, and she has concavity on this side of her trunk. And this is being induced by the horse. Look at this horse. This horse had bilateral front foot pain. And we can see that the rider's upper body is inclined slightly forwards. We've taken away the foot pain here, and immediately we've got a change in the horse's neck posture and its head posture compared to before the use of nerve blocks. The stride length of both the forelimbs and the hind limbs has increased relative to before the nerve blocks. And the rider's upper body position has changed. Her trunk is more upright, and the quality of contact she has through the reins has improved markedly, and her hands are now symmetrically positioned, whereas previously they were asymmetrically positioned. So this just shows the influence that discomfort in the horse can have on the rider. So I think it's important to realize that many of these behaviors, bolting, rearing, bucking, stopping, even falling, can influence rider safety and confidence, but can be caused by pain. So my take-home messages are that I think that this ridden horse pain ethogram is a very powerful tool. There's no doubt that some horses can live with problems and perform willingly and adequately. And I'm not suggesting that no lame horse can be ridden. They certainly can. However, I would suggest that unwillingness to go forwards or a display of 8 or more of the 24 behaviors of the checklist needs investigation. And ultimately, we may need to downgrade expectations. I think that we need to educate everybody that problems which have previously been labeled as training related, riding related, or behavioral, or that is just how the horse has always gone, are usually pain induced. But we can also use it the other way round. A low checklist score is usually an indicator that your horse is comfortable. It's in a positive emotional state. And that's a good thing and gives you reassurance that your horse is okay. So there's more information about the 24 behaviors available on the Equitopia website, where there is an online course. More about the 24 behaviors in this book, which also gives case histories of riders' experiences and their frustrations dealing with the veterinary profession. If you haven't seen it, the 24 behaviors of the ridden horse in pain is a emotional film which describes
Fantastic.
more about the 24 behaviors.
Yeah.
There is more information also on this website, 24horsebehaviors.org. And to show the other side, how horses can move and work with us in harmony, look out for this film, which is available on YouTube. So at that point, I think I'll stop and we'll go on with any more
Fantastic.
questions.
Oh my gosh. How long have you got? I mean, that everyone's going to be licking and chewing. I can almost feel this stunned silence in everyone in the group. Just phenomenal in information. I think right now is a really great time just to take a 5 minute break. Let everyone just absorb that. We're going to come back. I have a list of questions. Your work is phenomenal and I'm so grateful for it. So we're going to be right back in 5 minutes, guys, and get your questions ready. There is no such thing as a stupid question. And I really want to reiterate that. People going, oh, I don't want to ask something, that doesn't seem really, in depth. Please put your questions in. This is your chance to have Dr. Dyson, one of the best professionals on the planet, right in front of you. So get your questions in. We're going to take a quick 5 minute break. So we will be right back. Well, everyone, this is just an absolute treat to have had that presentation from Dr. Dyson. I see your questions are coming in, which are fantastic. Super grateful. We'll get to those in just a moment. I want to talk to you a little bit, Dr. Dyson. I think maybe you are muted. Are you muted? No,
No, I don't
no,
think so.
no, you're okay. So it was really quite amazing how quickly those horses changed after nerve block, because you hear so often amongst professionals where they say, "Oh, I don't think the horse is in pain. I think it's pain memory." And I've heard that come out of my own mouth before with, a behavioral issue where you're like, well, and the clients have said the vet's been, the farrier's been, that, they these are conscientious owners. But how much is pain memory a thing, or is it not?
Uh, I don't think it is in the ridden horse by and large. I think that
Wow.
there
Yeah.
are some things that horses can learn. So, if, for example, a horse has learnt to rear, and
Hmm.
that may have been triggered by pain initially, but they can learn to rear very quickly for a variety of different reasons. And they learn not to rear rather slowly.
Hmm.
If the rearing is continuously due to pain, though, that rearing will stop. But if the rearing behavior was triggered by pain and they learnt that they had to stop working then, they were being positively rewarded
Yeah.
for not rearing, then they say, okay, this is good. I'm being rewarded for not for coming to the ground, whatever. So that is a different issue. But if the rearing is being induced by pain, when you take away the pain, they will stop rearing.
Yeah.
Now, there is a slightly different situation when we see abnormal behavior when horses are tacked up. So some horses, which are said to be girthy individuals, so show girth aversion behavior. So they may kick, they may try and bite the person, tightening the girth, for example. Um, those behaviors take some time to resolve because those behaviors are in anticipation of pain coming when the horse is ridden. And it will take weeks after removal of the pain for those behaviors to resolve, but they will resolve if we've taken away the pain. So you've got two different situations or three different situations. You've got a behavior that's become a learned behavior and there is not ongoing pain. So for the example was rearing, which is not the result of current pain. And that is a habitual behavior. But the rearing that we see induced by pain will go away immediately. And these behaviors that we see tacking up, which are in anticipation of pain when the horse is ridden, will take some weeks to resolve once the pain has been resolved.
Yeah, that makes perfect sense that it would be a learned behavior that's positively reinforced. I mean, yeah, yeah, that makes a lot of sense. I think video can be a really, really handy tool. I'm just thinking about a lot of our students are, not in an area where they have a lot of instructors around them or people that can necessarily help them. People can set up a video. That's a good way for them to look back and assess the elements of testing whether the horse is in pain. I'd also seen in some of your work that you had set up videos at night in stalls.
Um, let's take it to two different things. So
Yeah.
acquisition of horses, videos of horses ridden is great, assuming that the video camera is positioned at an appropriate position
Mm,
and that the horse is kept in focus, filling the screen rather than this dot in the distance. So
yeah.
if you're using, for example, Pivo, which tracks the horse and keeps the horse in the center of the frame, then that's fine. But if you're using a mobile phone without a zoom function or you don't use the zoom function to make sure that the horse is filling the screen, then the video footage will not be of good enough quality.
Yeah,
So you
that
need
makes
video
sense.
footage of good enough quality. And I would also say that to evaluate it on the size of screen of a laptop is much better than the size of a screen of a mobile phone, because you
Mm,
will miss stuff by just looking on a mobile phone. And I've
mm,
tested that. I
mm.
looked at about 100 videos on the mobile phone and then looked at the same 100 videos on the laptop screen, and I was missing behaviors. So it's really
Yeah,
important that you look carefully at things on a big enough screen.
yeah, that makes sense for sure.
So with respect to overnight video footage, this is more related to horses which may show signs of discomfort in the stable. We know that the presence of a person, even just the fleeting presence of a person, will result in some horses concealing behaviors which may be a reflection of pain.
Mm,
So a horse can um, look normal when you look over the stable door or when you go into the stable, and it may stand in a normal posture and not show abnormal movements. But if you were to acquire video footage of that horse during the night when there's nobody about, you may see a very, very different picture. And Sue McDonnell and Catherine Torsiva from the University of Pennsylvania have done a wonderful piece of work demonstrating what I'm saying. And they have published this with lots of video clips, and it's open access, and it's brilliant, really, really brilliant work.
yeah,
So even the presence of you can see also when you look at the frequency of the behaviors, the horse is behaving abnormally, the person arrives, all those behaviors disappear. 5 seconds later, after the person has disappeared, the behaviors recur. It is truly amazing. And it's because horses are prey animals,
mhm,
so they have evolved to try to disguise their pain. And this is what we also see in the ridden horse.
mm,
They have adapted their movement patterns to try to conceal lameness. So when you have a lame horse, a lame in even in the conventional sense, an limping horse, it will stiffen its back in order and take shorter steps in order to try to minimize the display of lameness so that they
wow,
are less likely to be picked out by the lion for dinner.
yeah,
So it's been an evolutionary process for them to try to conceal their discomfort. And
it's
they will
amazing.
even increase the length of time that each limb is on the ground. So they're sharing load between limbs for a longer period to try to minimize their discomfort. So they're really very clever
Very
at
clever.
disguising lameness, which makes it more difficult for us. But that's why this observation of behavior is so important, because
Yeah,
these behaviors, albeit relatively subtle, but once you've seen it, you can't unsee it. I can guarantee that. If you're looking and you've seen it, you will continue to see it. And it is just such a good indicator of the presence of discomfort.
it is such an incredible tool, guys. I can't tell you how much it can help you. Okay, it can open a can of worms, but
Oh,
you
yeah.
want to open that can of worms because you want to know when you swing your leg over your horse and you're heading out, you want to know that your horse is in comfort. You're going to feel better about that because I think a lot of us, we can trust our intuition and you know deep down something's not right. Even if the vet's been and said, they're fine, physios, they're fine. And you're like, but I know something's not right. You've got to trust that and be a detective. So I had a question. Have you seen any correlations? You've seen thousands of horses through this work. Have you seen a correlation between the way that they're kept, perhaps the way that they're fed, the type of training that they're in? Is there a kind of lean in horses that are in pain? Are you seeing any common elements that we need to be aware of, or is it just across the board?
I would say it's across the board.
Mm,
And In fact, if you look across the board, you'd probably see more of this in the lower level horses than you would in the upper level horses, because the upper level horses are probably under more intensive veterinary care, and
Yeah,
the riders are more perceptive of identifying a problem and wanting to jump on it because they know the impacts that discomfort can have on performance.
yeah,
And therefore, they want to optimize performance.
yeah,
And the other thing is to comment here is that so much of behavior and poor performance gets blamed on gastric ulceration. And we've had an increasing recognition amongst the medical medicine experts, as well as myself, that gastric ulceration is often secondary to chronic musculoskeletal pain. And therefore, the trend has been among horse owners and veterinarians, the horse is not going right. The vet can't see any lameness in hand. And so, therefore, he suggests, well, maybe we ought to perform gastroscopy. We need to scope the horse's stomach. And then ulcers are identified, and the horse is
mm,
treated for ulcers. And the ulcers may go away, and there may be a transient improvement in the horse's performance,
yeah,
but it never returns to normality. And then if the horse is continued in work, the ulcers come back because the stressor, which is inducing the lameness, well, inducing the ulcers, is actually the presence of
yeah.
lameness.
It's the secondary thing that we're healing, not taking
Yes.
care of the root of the problem.
Yes.
Oh boy. So let's say that our members, they go out, they follow your work, check their horse, watch and go, oh boy, I've got a problem. Where do you go from there? What It's going to take a little bit of a multifaceted approach to help these horses. What is your advice to someone who follows your work, what looks at their horse and goes, I've got 10 behaviors or 10 indicators? What do they do?
Well, they've got to go to a veterinarian who is skilled enough to evaluate the horse ridden and perform nerve blocks to identify where the sources of pain are. And some vets are not very good at doing this or are reluctant to do this.
Mhm.
But armed with the ethogram, an owner can go and say, look, I've used the ethogram. This is a proven tool. I know my horse is uncomfortable. Please watch me ride the horse and please do nerve blocks. And this has happened. If you read in the book Harmonious Horsemanship, there are
Yeah.
stories of people doing this and getting to the right results, and it being a learning experience for the vet as well. But it's no good going to necessarily the local practitioner down the road who is qualified as a veterinarian but is doing cows, horses, and maybe small animals because they won't have the right level of expertise. And even somebody who is a so-called equine veterinarian only will not necessarily have the expertise. So you've got to have somebody who has embraced lameness as one of their key interests, lameness and
That
poor
could be a
performance,
challenge.
which can be a challenge. Yes, absolutely.
Yeah.
So on the 24 Behaviours website, there is a checklist of things to ask a vet if you're thinking
Mm,
about using them to see whether or not they have the requisite skills that are going to be able to do the right job for you.
yeah.
And what I would say is don't get drawn into the potential solution of let's do a whole body bone scan, because whole body bone scans are likely to throw up spurious results, false positive and false negative results in adult sports horses. They have very little value in this type of clinical situation. They're of huge value in the young, poorly performing racehorse, which has a lot of bone turnover and a lot of stress-related bone injury. But in the mature sports or riding horse, the whole body bone scan is going to be expensive and not
Very.
be very helpful.
Yeah, that makes sense. I want to touch back on something that you said um, about not all lame horses have to be not ridden. So let's say someone comes does your work, has a 10-meter circle, 20 meter, and goes, oh boy, I've got 10 of these. But when I'm out hacking in a straight line, my horse feels fabulous and doesn't, not maybe isn't a really stoic horse that's hiding it. What are your thoughts on that? And
That's why I made the comment at the end that you
yeah,
may need to downgrade your expectations, because there
yeah,
are plenty of horses that are very happy hacking out in the countryside or going hunting or even jumping cross country, despite the fact that they have got low grade pain, which may create in an arena situation the
mm,
display of eight or more behaviors, but out in a different environment, in straight lines predominantly and with a little bit of adrenaline going too, that horse may be a completely different individual. And therefore, I would say that type of horse we use in the situation in which it is comfortable. Now, we
mhm.
need to check that the low grade lameness isn't the result of, for example, a tendon injury, because if we
Yeah,
keep going with a tendon injury, that horse is going to get worse. But it may have some arthritic changes in one or more joints. You've got that, you're not necessarily going to make the horse worse. It's not necessarily a progressive condition. People tend to think about arthritis as always being progressive. It's not. It can just cause episodic pain.
mm,
And that pain may only be evident under certain situations. So read your horse. And if your horse is happy going out hacking, then by all means hack it.
mm. Yeah. I'm really glad that you said that as well, because I think, there can be some horses, maybe they're getting on a little bit and they're a little bit stiff. Anything with a skeleton can feel the stiffness and soreness. But actually going out and doing some light work and work that they both, the rider and the human, enjoy, can actually help the horse feel better in the long term. Would you agree with that?
Absolutely 100%. And I would say also that doing exercises from the ground, Pilates type exercises,
Mhm.
whatever you want to call them. And Gillian Higgins has published today a new book on Pilates for horses.
Oh, wow, great.
Um, those types of exercises, which facilitate mobilization, I think are good. Movement of the horse continuously, so living out as much as possible, being fed from the ground so that they're stretching their back. Um, Everything about movement and continual movement is potentially of benefit. Being in a
Yes.
stable for 23 hours of the day is not good for horses and both mentally and physically. So I think continual movement and use of the muscles and using ground exercises to facilitate the either the maintenance of muscle mass and tone or the recovery of muscle mass and tone is potentially very helpful as well.
Yeah.
And I don't think you can underestimate the value of those things. So, working together with a manual therapist is of great benefit, as is working together with a good farrier, very, very important, and a good tack fitter as well, very important. So,
Yes.
I think you use the term holistic approach. I believe very strongly in a holistic approach. We have to address everything: the
Yeah.
horse, the tack, the rider, their position, their fitness. Because if you are sitting constantly crookedly, that's not good for the horse's movement patterns. If
Hmm.
you need to be sitting correctly yourself.
Hmm.
So think about you as an important part of this athletic combination. You might not see yourself as an athlete, as a pleasure rider, but you are an athlete. You are part of this two-way harmonious relationship.
Yeah, it's a moving dynamic.
Yeah.
Absolutely. We have to keep up our end as well of
Yes.
keeping as best we are able our balance and our health and our fitness. But I'm really glad that you said about downgrading our expectations. I think that it's great to have dreams and goals, but if we can see that our horse, that's just not going to happen. That downgrading our expectations and realizing you can still have so much fun and joy with your horse doing something else. And that's something really important. Okay, I'm hogging you, so I'm going to go to some of the questions. So Carol has said, my horse has a lateral 4-beat canter. Could that be due to pain, or is it breed related? She is a Morgan.
Um, as a Morgan, it could be breed related, yes. I think you would then have to evaluate the horse's behavior and also compare whether if you go out for a hack and the horse is excited, how does it canter then versus in an arena? Because if the horse can canter properly outside the arena, then its inability to canter correctly in the arena is more likely to be pain induced. So compare the horse under a variety of different circumstances and also compare the horse sitting in a 2-point position versus a 3-point position. Because if the horse is able to maintain a true canter with a rider sitting light in a 2-point position, but then falls back into a 4-beat canter when the rider is sitting, that probably also indicates that there's some underlying discomfort.
Great advice. I love that. Melissa said, I read recently that a horse who is traveling with its head to the outside is trying to brace its back to prevent a painful movement. Have you noticed any correlation to the head tilt to specific body issues?
The simple answer is no. The head tilt is just an adaptation to discomfort.
Yeah.
And the horse is just trying to protect itself to some extent. And when the whole body neck is turning to the outside, that's a protective mechanism, but it could be for a forelimb lameness or a hind limb lameness, and it certainly couldn't be related to a specific source of pain.
There you go. That's a very definitive answer. I love that. Okay, Lynn said, what if you observe these signs? Oh, this is a hard one because many of our members can only have access sometimes to riding school horses. If you observe these signs in a lesson horse, where do you have the authority to obtain care for the horse? How would you handle this situation? Of course, bring it to the intention of the instructor, but would you not ride that day, even if you're encouraged to do so? A lot of people are in that situation, I think.
Yes, I think that the riding school issue is a difficult issue because in order to be a suitable riding school horse, the horses need to be quiet and biddable and predictable, more or less.
Stoic.
And as a result, I think that a lot of riding school horses do have chronic low-grade discomfort. Um, and it then depends how frequently that horse is used and what all of the other management practices are in terms of how severe that discomfort may be. And I personally think there's probably an underuse of pain relief in these horses. And I think that the judicious use of drugs such as phenylbutazone, which will provide some pain relief in many horses, is probably underutilized. So if you felt that the horse was really uncomfortable, then I think you need to say, no, I can't ride this horse. And I know that's
Okay.
difficult. I think it places everybody in a potentially difficult situation, but I think we need to acknowledge this.
Mhm.
Um, and there's no simple solution, I don't think, for riding schools,
Can't.
except that I think we could probably do more teaching of riders in the initial stages off horses. So, for example, on a
Mm.
riding simulator, so that the people develop the basic balance and musculoskeletal strength and coordination on the simulator rather than having to do that early work on a horse. And then I think that would help the horses. And if more attention was paid to um, appropriate saddle fit for both the horse and the rider in the riding school situation, I think it would also improve the weight distribution of the riders and therefore the comfort of the horses. So I think that there are a number of things that we could collectively do to try and improve the situation. But I think if you genuinely think the horse is too uncomfortable, then you have to follow your conscience and say, I think the
Speak
horse is
up.
too uncomfortable.
Advocate for the horse. It is a really difficult situation because quite often you'll get people, owners or trainers, and they know. they know deep down that their horse is uncomfortable. They may not feel like they have any other option, but we have to do better. And it's, there's ways that that can be done. The riding simulators is a fantastic idea, so the horses are not having to carry completely unbalanced riders while they find their stirrups and find their way, while they bounce, avoid the bouncing around on their back. So I think that's a really, really good idea.
But
In
at the
fact,
same time, I think we have to give the people some contact with live horses so they can be
sure.
grooming horses, they can be
Yeah.
tackling up horses, or they can be doing some groundwork with the horses so that they
Yes.
learn that empathetic interaction with the horse and learn to observe the horse and how
Yeah.
the horse is reacting.
Yeah. I think that's exactly right. Uh, Kathy says, what happens when we don't have the expertise in the area? I'm thinking she's meaning of healing. How do you feel about chiropractors, magna wave, etc.?
Um, I think a lot of a good manual therapist can help horses, particularly in the rehabilitation phases of treatment of a problem. And they can also be quite good at managing early problems and recognizing early problems. So I am an advocate of horses being regularly assessed by a good manual therapist because they can often identify problems early on. We also have to recognize that a manual therapist in a horse which has had long-term problems could potentially rock the apple cart. So they may do some treatments which enable mobilization of the back. And the back was that protective stiffness that
Wow.
was saving the horse. And you take away that protective stiffness, and then the can of worms is then bursting open, and the horse is saying, "Help, I'm
Mm,
now obviously lame."
mm.
So I think we have to it, I'm a great advocate of the use of manual therapists, good manual therapists,
Yes, good.
be they a chiropractor or an osteopath or a physiotherapist, but they need to know when it's appropriate to intervene and when it's not.
Yeah. That makes a lot of sense. And I think working with them in terms of rehab as well. Like I have a mare, she was born with not great stifles. And cut a long story short, she had a field accident. Stifles have been an ongoing issue, and it's taken a small army to help get us where we are. But equally, it's hard when you know that your horse is mildly uncomfortable, yet you're being told, listen, you need to go out and ride straight lines. You've got to get the weight off her and keep her moving and working to be able to help with this pain as well. And I think that's really hard for compassionate owners to go, oh God, but I feel bad. And you get caught in this cycle of like, well, if I don't exercise the horse and do the work, then it gets worse. They get fatter, and it's hard.
It is. And I think you brought up a very important point about weight management because weight management is hugely important. And I think just like behaviors were historically normalized, I think obesity in horses is becoming normalized. And you have to think that if the horse is 580 kilos and it should be 530 kilos, it's carrying 50 kilograms extra
Yes.
weight, which is harder work, more load on the limbs, more likely to predispose to the development of subclinical laminitis, and also can alter various other metabolic pathways that may increase susceptibility to injury. So there are all sorts of reasons why we have to keep horses slimline. And
Yeah.
particularly if the horse has got a pre-existing problem, a control of body condition is of paramount importance.
But that needs to encourage more movement, more exercise. And then you feel trapped by them, well, then they're uncomfortable. But the more you can get them moving, with get that weight down, because obviously, forage is important. You can't starve them. That's being completely debunked about starvation paddocks, and they've got to keep eating. So you therefore have to get exercising. And I think at some point we have to, pull on our big girl panties and go, right, we got to get out hiking, or we got to get out riding, and we've got to get this weight shifted. And quite often, like you said, once the weight comes down, there's a lot less strain on those joints and strain on the articulations, and the horse can find comfort. But it's a big can of worms, but it's something that we've got to go there.
Yes,
And
and to an extent, we have to compromise sometimes, and we have to recognize when the horse is not suitable to do the job. Because sometimes we do have to face that reality. And
yeah,
that may be tough, but I think it's an important decision from a welfare perspective that
yes,
we have to recognize that some horses cannot be adequately rehabilitated,
yeah,
even to do a downgraded job.
yeah.
Um,
And
and to
that's where
continue to do
retirement
so.
is
Yeah.
the kind thing to do. Yeah. And that's I know we're coming to the end of our time, and I could literally talk to you all day. You really, I cannot tell you how wonderful the films are that Dr. Dyson has done. You can find them all on YouTube. I'll also post them all into the Facebook group. I highly recommend her book, Taking the Course. All of these links I will put into the show notes for the webinar, so you can start your own investigations into your own horses. And I think something really important that you said, it's not just about knowing whether your horse is in pain, it's also giving yourself the reassurance that your horse isn't in pain. And what a wonderful thing that is. I know you studied over 800 horses that were free from pain. And if you can start to use observation and do this work with your horse and go, okay, they're not in pain, that's great, but keep revisiting to go, well, actually, it's 6 months down the line now, their muscles have changed, their life has changed. Are we now facing issues? And that's what's beautiful about your tools that you've created, Dr. Dyson. They can be used again and again.
Yeah, and they can be used by anybody. I mean, they were designed to be used by anybody,
Yeah.
and it does take practice. But with practice, you can use the tool, and it will be effective for you.
Yeah. Thank you so, so much. And I just love your humility. I didn't get to mention this right at the beginning, but you're like, I've sort of trained some horses to a reasonably high level, like the Olympics and badminton, and like your humility is amazing. So, guys, you're in safe hands here with Dr. Dyson's work, and I just can't wait to hear from all of you how you go on with applying it with your own horses. And don't freak out and panic if you realize that the horse that you love to do things with is showing pain, because now you get to do something about it, and your relationship will only deepen through doing this work and helping your horse. So people are coming in saying how wonderful the webinar is, and thank you. So Dr. Dyson, I would love it if you'd come back again sometime and spend some more time with us. And thank you. You really have changed the world for horses. So thank you so much.
Thank you very much, and it will be a pleasure to come back again.
Thank you. And on a side note, I really want you to come down to Cornwall.
I was in Dorset yesterday.
That's nearly there. You're nearly there.
Thank you,
Thank you.
Dr. Dyson. This was incredible, and we have so many notes and resources to share with everyone that was here. Really enjoyed this.
Great, great.
And to the members, don't forget, we have a Pivo that you can win this month. So Dr. Dyson was talking about how a Pivo can help you assess your horse. Check your inbox. We've sent you a competition link for a Pivo where you can send in your video testimonials for the club, and one of you is going to win a Pivo. So time is running out on that one. Get in there and you'll be able to use that to assess your horse. So thank you all so much.
See you next
Bye,
time.
guys. See you next time. Bye. Thank you, Dr. Dyson.
You're very welcome.